Session. Doctor, over to you, Dr. Dhanesh. You can start your session now.
Thank
Dr. Dhanesh. Yeah.
धन्यवाद सर धन्यवाद.
Good evening, good afternoon, and good morning. This is the
Good night sir. Good night.
1099th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. VIPAKSHI WASNIK. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30, and from 8:30 to 9:30, the international session in English, and from 9:30 to 10:30, we have a local language session in Malayalam. All these sessions are going in a good way, and we are uploading the videos of the same on the very next day itself, so that you can subscribe the same as well as you can watch it and you can share it with your friend to take homeopathy around the world as well as to each and every household. This is the purpose of homeopathy, IFPH. And as you all know, as just Sahani sir has mentioned about the tomorrow's importance, we have a very good session in Hindi, and that is the celebration of Dr. Sahani's 100th day celebration. And at English, we have the 1600th day celebration, and to honor the National Commission Chairman, Dr. Anil Kurane, because he has done a lot of good work for homeopathy from his part with his team. And very recently, the NCH has approved 6 diploma courses after degree courses. So that's all duty of homeopathy. That kind of work is going on there, and we are very happy to congratulate all of them here. So please hope all of you will be there with us tomorrow for this function. In the you will be, also participate in the celebration. And let me come to today's verse. As you all know, today our guest is Dr. VIPAKSHI WASNIK. The doctor has completed MD in homeopathy, then PhD scholar and MBA in hospital administration, and he has taken MD in psychiatry. He's working as an associate professor, homeopathic materia medica, merchant homeopathic medical college hospital, Gujarat. Already has done a presentation in this forum, and he has more than 6 years of experience. And today, Doctor will be talking about a very important subject that is related to mind. The mind whispers, exploring the psychosomatic dimensions in homeopathic treatment. We all know that homeopathic fraternity is very much interested in mind, because the mind that gives the right remedy to cure the patient, not simply palliate the patient, but to cure the patient, we have a very good chance in finding out the real picture of the mind, a real personality. Studying the real personality, we will be able to restore him back to health. So we are proud to have we invite our guest of the day, Dr. VIPAKSHI WASNIK. Welcome, doctor. You can listen for the next 45 minutes, and then we will have a discussion.
Sure. Thank you, sir. Thank you, Dhanesh, sir. Now I will share my screen.
Yes.
I think my screen is visible
Yes,
now.
everything fine. Everything fine.
Okay. Yeah. So thank you, Dhanesh, sir. So good evening, everyone. My name is Dr. VIPAKSHI WASNIK, and I'm honored to present this topic, that is the mind's whisper, exploring the psychosomatic dimension in homeopathic treatment. Today, we will discuss how emotional and psychological dimensions intermingle with physical symptoms in patients, illustrated through two detailed case studies. So I'm presenting two cases of my OPD, and there we need to explore how the patient's physical symptoms are correlated with their psyche. So here is the case number one. This case belongs to Mrs. SSP. She is 28 years old female, married since 3 years, educated up to B.Ed. She's done graduation, and her purpose of visit in my OPD was she wants to take homeopathic medicine for her irregular menstrual complaints. She tried various allopathic doctors for her complaints, but she didn't find any improvement. So at last she came for homeopathic medication. So about history of her presenting illness, patient had these irregular menstrual complaints since her menarche. She had take allopathic medication, which includes iron folic acid tablets, but the complaint persists. Even after marriage, there was no any significant change in her irregular menstrual complaints. So this is the chief complaint of the patient. As you can see, just before menses, patient having a slight heaviness in her lower back. During menses, patient having cramping pain. Patient described it as an gripping pain, and intensity is very severe of that pain. Last menstrual period LMP in somewhere in July 2024, as the date is not remembered by the patient, and LLMP means last to last menstrual period in somewhere in May 2024. Again, the date is not remembered by the patient. But patient provides the data that her menses appears dark red in color, occasionally fishy smell is there, and moderate clots are there. All these menstrual flow is remains for 1 to 2 minutes, and flow is very heavy, and the pain, that is cramping pain, it is aggravated during menses, and it is ameliorated by warm application. Along with that, patient having generalized weakness all over the body. Along with that, patient having irritability and pain in back also. After menses, when the menses stops, patient having the mild leukorrhea, and leukorrhea is watery whitish in color. It is consistency sticky, occasionally bloody, with very mild thin strings are present in there, and this leukorrhea remains for 1 to 2 days. Along with leukorrhea, patient having intense itching over genitals. So these are the chief complaints for which patients seek homeopathic treatment. So when we move on to the physical generals, uh, patient's appearance is she is lean thin with fair complexion. She had moderate perspiration, and partial perspiration is on her back with white stains. Means when perspiration get when the perspiration is soaked, it give white stains to the clothing. Thermally, patient is ambithermal, but it moves towards the hotness, which means patient thermally ambithermal towards hot. Patient having a specific craving for salty food and sweets. But sweets craving has a peculiar feature that whenever patient eats anything sweet, she just add a little bit salt on it. That's a very typical feature in her sweet cravings. Here is the mental complaints. She had fear of being alone and fear of going out and meet her friends. But the intensity of these fears are very mild. So that is nothing much Hence there is nothing significant there in the fear section. So let's see her menstrual history in detail. So as I already mentioned, the last menstrual period, LMP, that the date is not remembered, but she said that somewhere in July 2024. Last to last menstrual period in May 2024. If you can see the difference between the LMP and LLMP, it is around 3 months. So patient have irregular menses in that extent that she had no menses for at least 2 or 3 months. When we talk about her menarche, so her menarche is early, it is at the age of 12 years. And since then, patient has irregular menses, which I already mentioned. The menstrual flow remains for around 5 to 6 days. Flow is heavy, quantity very profuse. She used 3 to 4 pads per day, and that pad is completely soaked with blood. So that in that extreme, that excessive heavy blood flow she encountered during menses. Color of the menstrual blood is dark red in color. She also had a medium-sized clots during menstrual blood flow. The consistency is sticky in nature. Occasionally, patient having a fishy odor, and stains are brownish and indelible. So, concomitants of menstrual history. So, just before the menses, patient having slight heaviness in lower back with occasional mild headache. And in the beginning, when this menses is up to come, her heaviness in lower back is slightly increased with occasional headache. During menses, when the blood flow starts, her lower back pain is increased with mental irritation, and during that time, patient gets angry very easily. When the menses stops, her back pain is also reduced, and leukorrhea begins. So, leukorrhea onset when the menses stop. Leukorrhea remains for 1 to 2 days. The character is sticky, occasional bleeding with thin streams, which I already mentioned. Color, it is generally watery and whitish, and its effect is that it causes intense itching over genitals. So in past history, we don't find any major illness in past. Family history, her father and mother both have hypertension since 10 and 8 years respectively, and they are all on allopathic medication. In general examination, everything is within normal limits. Systemic examination didn't show any abnormalities. So from the above case, the final diagnosis is dysmenorrhea with irregular menses. This diagnosis is made up with the help of ICD-11, and its code is N94.6. So here's the totality of symptoms which I collected, as you can see. And here is the repertorization. And you can observe that the most similimum remedy is coming is sepia. So based on the repertorial analysis, final selection of remedy was sepia. It is given in 1M potency because the intensity of patients presenting complaints is moderate to severe, and it indicates status of a susceptibility, which is moderate to high. So by considering her moderate to high susceptibility, selection of potency is also high, that is 1M. And there is a follow-up criteria which I formulated for this case. As you can see, it is mostly related to the menstrual complaints, that is LMP, irritability, profuseness of menses, dysmenorrhea, leukorrhea after menses, and itching at genitals. So these are the follow-up criteria. As you can see, on 18th of September, see, patient come in September for the case definition. So case definition was done, and Sapia 1M single dose was prescribed. On first follow-up, means that is on 24th of September 24, menses not appear. So, and no any new symptoms was there. So Sapia again repeated 1M single dose for 1 week. In both the follow-ups, I advise the patient that she immediately reports me if she had menses, right? So on second follow-up, that is on 7th of October 24, patient reports that she had menses on 6th of October 24. Her irritability before menses is reduced by 50%, dysmenorrhea reduced by 20%, and she came up on second day of menses. So the leukorrhea complaints and itching complaints are not present there. So I kept patient on SL. So SL was prescribed for 1 week. Then on third follow-up, see, this is the turning point of the case. On third follow-up, that is on 16th of October 24, her menses stopped, and she reports that her leukorrhea complaints were also ameliorated by around 50%. Here, patient feels better, but patient says sorry about not sharing her past history of her complaints at the start of medication. So she shares that she had 3 abortions, and due to that, she had intense stress from her in-laws family. So the given data, the new data was collected from the patient, and recase taking was done, because initially patient was not providing this information at the start of the case definition. So these are the data. So this is the data new with the recase taking was done with new data. So history of presenting illness. Patient experienced her first miscarriage within 6 months of marriage, followed by 2 more subsequent miscarriages in 2 years. She did multiple investigations. It included ultrasound, hormonal profile, infection screenings, but it revealed no structural functional abnormality. She also consulted multiple gynecologists but didn't get results. Finally, she shifted to homeopathy under the pressure of her husband. But she present her irregular menses complaints and hide her abortion history. I suspect that maybe she was not trusting the physician because she was forced to come to the homeopath by her husband. So that's why I think she's not sharing her past history with me at the beginning. So, so these are the obstetric history of patient. As you can see, pregnancy is 0, gravida 3, para 0, and abortions. All 3 abortions were threatened in nature. She had threatened abortion 3 times. Pregnancies, all 3 pregnancies were unplanned and unwanted. Patient having very severe morning sickness during those pregnancies. She is not able to eat food. Even smell of food causes intense nausea. So in past history, we have a threatened abortion with no any history of major surgeries. Here you can see the photograph or previous investigations. So to protect the patient's identity, I cropped the name of patient from our all investigations. Nothing significant abnormality is seen here. These are the investigations of her third pregnancy. It's the latest pregnancy. These are the reports of her second pregnancy. Here in first case, you can see her TSH level is significantly low. That is 0.005, severely low. At this point, her gynecologist start her hormonal treatment. She took all the hormonal treatment, and after that, on 6th week, 6th day of pregnancy, she had abortion. So now a detailed life history was taken. Initially, patient didn't share anything. So in childhood, patient grew up in a very conservative family. She was academically sound and she wanted to pursue her higher studies. She did B.Ed graduation, but her father denied her to pursue further education. She was married against her will. Her spouse lacks emotional connection with her. Her in-laws were pressurizing her to get pregnant. Patient said she was not ready for that. But under her family pressure, she tried but had 3 consecutive abortions. She also felt detached with her in-laws' family. So, as she denied to pursue higher education by her father, but he allowed to he allowed her to work as a primary teacher for 6 months just before her marriage. But after marriage, she forced to quit that job. Now she is a homemaker and with no career opportunities. Currently, she has a very strained relationship with her in-laws, and the current emotional status is she has resentment towards in-laws, internal conflicts between her personal desires and family pressures, and sometimes she feels depressed and guilt over inability to communicate her feelings openly. So from the new data, we can say that patient as a person, patient is very reserved, anxious, and indifferent. Here is the repertorial totality which I formulated. I formulated by using the Kent's approach because there is a lots of characteristic mental symptoms was there. So you can see mind is indifferent, reserved, fear of being alone, irritability before menses, nausea, pregnancy during, nausea, aggravation, smell or food, pregnancy during, abortion tendency to about, abortion bearing down sensation. So all these symptoms were taken into consideration, and this is the repertorization. As you can see, the most simillimum remedy is sepia. So other close coming remedies are pulsatilla and natramur. So this is the remedy differentiation in close coming remedies. We can differentiate these remedies into various aspects, like the emotional state. In sepia, there is indifferent and emotionally detached, natramur reserved, suppressed grief. In pulsatilla, emotionally dependent, expression, weeping. Attitude towards support. In sepia, there is a rejects sympathy and consolation. And there's a consolation aggravation is there in sepia. Same is seen in natramur. And in pulsatilla, patient craves for consolation and sympathy. Consolation amelioration is seen in pulsatilla. When we analyze the menstrual complaints, sepia having profuse, dark clotted menses with dysmenorrhea. In natramur, there is a profuse dark menses with weakness, and in pulsatilla, there is a scanty, irregular, painless menses. When we analyze the case in onoleucoria, we see the sepia having sticky, itchy, post-menses leucorrhea. In natramur, there is an egg white-like texture of leucorrhea. It's non-itchy. And in pulsatilla, it is bland, creamy, or yellowish in nature. Psychosomatic link. When we analyze the sepia on the psychosomatic level, sepia emotional suppression is there and rule of fatigue. Natramur unresolved grief and disappointment is there. In pulsatilla, emotional instability and dependence is there. Modalities: consolation before menses, exertion, consolation, heat exertion, warm room amelioration, rich foods, emotional stress, etc. So key feature of this remedy differentiation is in sepia, there is indifference to the loved one with responsibilities. In natramur, deep-seated grief was there with resistance to openness. And in pulsatilla, there is a dependency on others and fear of abandonment. So when we see, you can see that my patient is very close between sepia in Nettermure. But after considering her physical symptoms and modalities, final selected remedy was sepia. So I kept the same follow-up criteria because right now patient is not pregnant. So her pregnancy or abortion related symptoms were not considered in this follow-up criteria. So here you can see on the third of follow-up where patient says sorry and she share her past history. Here, after collecting all this additional data, sepia 1M single dose was prescribed for 1 week. In this time, patient feels better about her complaints, and here patient developed trust on physician, and she share her inner feelings on the first time. So on fourth follow-up, that is on 25th of October 2024, patient have no any new complaints. Patient again feels frustrated about her current situation because of her family dynamics. So again, sepia 1M single dose was given for 1 week. Mental frustration was there, and that is due to her family involvement. So here I can say that sepia acts well on physical level. On fifth follow-up, that is on 14th November 24, patient reports appearance of menses on 9th of November 24. And the other associated complaints were ameliorated by 50%. So sepia 1M single dose was given. So here you can see the regular menses appears. So we can say sepia acts well with no any aggravation. So on 6th of follow-up, that is 26th of November 24, no any new complaints was there. And here patient asked me why she is suffering from all this. Even all her investigations are negative. Still, why मैं क्यों suffer कर रही हूँ इन चीजों से? That was her sentence. So at this particular time, I give counseling to her, and I try to correlate her situation, her symptoms with her family environment. But at that particular time, she is not able to understand those correlation. So sepia again, 1M was given, single dose. And here you can see sepia acts well again in all domains, mind, body. But due to her family environment, her frustration remains as it is. So on 7th follow-up, that is on 9th of December 24, latestly, patient reports that her menses appears normally. Now, because her menses appears normally from last 3 consecutive months, her in-laws start pressurizing again to get pregnant. And the patient was not willing to do so. So thus her frustration increases. So here we can see again her environmental factor becomes the maintaining cause of her frustration. So again, sepia 1M single dose was given for 1 week. So similar conditions was also there in 8th or 9th follow-up, as she is currently took medicines regularly. Until and unless she will not accept her environment, family environment, or leave the environment, or cope up from the given condition, her frustration remains as it is. So sepia, in my understanding, sepia may act partially here, and it frustrates, her frustration remains as it is. So the complete cure is stuck up at the mental plane. Though her physical symptoms improves, her mental complaints remains as it is, because she is living in her, because her family environment is very frustrating to her. So now, what is learning from this case? What I learned from this particulars that I want to share with you. So first and most important is the importance of doctor-patient relationship. See, initially, patient hesitated to share her emotions, even her complaints. This highlights the need of trusting doctor-patient relationship. This hesitation may be due to I am a male physician, and also patient belongs to reserved family, so might be that is a block, and because of that she is not share her uh, detailed case with me initially. But once she had developed that trust, she expressed all her deeper emotions over the period of time. So the second learning is empathy and understanding. Empathizing with the patient situation and validating her emotions create a safe space for her to reveal the psychosomatic aspects of her condition. My second understanding was the role of psychosomatic understanding, that which is the basis of this presentation. So we as a homeopath, we all know that there is an interconnection between mind and body. The patient's repeated abortions was not due to her physical abnormalities, but rather her emotional conflicts and psychological distress about her marriage and societal pressures. This demonstrates a significant influence of psyche on physical health. And this particular thing was again described in aphorism number 210 to 230, where somatopsychic, psychosomatic, and pure neural, these three types of mental disorders were also described by Dr. Hahnemann. So that is that particular aphorisms were uh, in this case. So emotional suppression as a root cause, that is again another important learning. Her indifference, her irritability, emotional withdrawal that are linked with her unfulfilled aspirations, and forced compliance to get pregnant. So this contributed her recurrent physical complaints, which includes menstrual irregularities, dysmenorrhea, and abortional tendencies. My third learning was role of family environment as in maintaining cause. See, the patient belongs to a conservative family environment. This places an immense pressure on patient to conform to traditional roles, disregarding her personal aspiration and desires. This may causes conflict with her personal goals. Patient desire to pursue higher education was initially suppressed due to her in-laws, and family insistence on motherhood create internal conflict and psychosomatic distress. And the last is limitation of homeopathic medication. Sepia may bring her menses normal. So as for my understanding, it's a limited action of sepia. But it's her family environment which acts an obstruction of cure or acts an maintaining cause. So here, limitation of homeopathic medication is seen. My last learning from the case is the holistic assessment. We should understand the patient's life history, emotional background, family dynamics. It's a very important considerations as physical symptoms in achieving the lasting healing. We also address the maintaining causes, identify and address the external factors, like in this case, the family pressure that perpetuate the illness is crucial for successful treatment. And last is learning is patient's empowerment. We encourage the patient to reclaim her aspirations and autonomy alongside homeopathic treatment. This can foster emotional healing with physical recovery. But till now, that is not achieved. So here is the case number 2. This case is of Miss GKP. She is 23 years female. She is single, student, and she wants homeopathic medication for her frequent episodes of headache. So the history of presenting illness consists of this condition, means these headaches patient have since her adolescence age. She took allopathic medication on that, but there is no any relief. She took painkillers, most specifically naproxen. 500 mg was taken by her to relieve her head pain. So these are the chief complaints. As you can see, location is head, temporal region. Sensation includes throbbing pain, congestion, stiffness, and throbbing and congestion it is this pain is very severe, intensity is very severe, and it is progressive in nature. These complaints ailments after suppressed anger, aggravated by disturbed sleep, aggravated by hunger, aggravated by extremes of heat or cold, and stiffness at the nape of the neck patient have during headache, and that is ameliorated by high pressure or after taking allopathic drug, that is naproxen. Along with head complaints, patient having irritability, oversensitiveness to noise, sound, light, etc. Patient is unable to concentrate in her studies during headache. So these are the chief complaints. Here's the associated complaints. Along with headache, patient having a history of irregular menses. The menses is scanty in nature, and menses remains for only 2 days. And this irregular menses patient having since last 5 to 6 years, and it is progressive in nature. Patient having lower abdominal pain before and during menses. During menses, patient having frequent mood swings and nausea during menses. So here is the detailed menstrual history of the patient. As you can see, LMP, the last menstrual period, date is not remembered, but it's somewhere in May 2024. And last to last menstrual period is on February 24. So again, here you can see the difference between the two menstrual periods, that is February to May, that is around 3 months approximately. Patient have no menses. Menarche, it is again early at the age of 12 years. Menses is irregular as described above. Duration, if when menses appear, it remains for 5 to 6 days. Flow is scanty. Quantity scanty. Patient uses only single pad per day, and that pad is also partially soaked. Color is dark red. Occasional clotting is there. Consistency is sticky in nature, and occasional fishy odor is there. Stains are brownish in color, but they are deliable or washable. So just before the menses, patient feels heaviness in lower back. At the beginning, her heaviness in lower back is slightly increased. During menses, patient's lower back pain is increased with mental irritation, and after menses, her lower back pain reduced. So when we come to the physical generals of the patient is obese young girl with multiple acne marks on face. See, patient don't have acne on her face, but she had acne marks on her face. Perspiration is heavy, especially around the neck and back. Craving for sweets and hot food. Thermally, patient is hot. And she have a specific fear of closed places like elevators and all. Patient having dreams of ocean and dreams of flying in air like a bird. These are the peculiar dreams she frequently had. Past history, there is no any significant past histories there. Family history, nothing significant. Father having allergic rhinitis, mother having hypothyroidism in 19 years. Both are on allopathic medication. In general examination, everything is under normal limits except the weight, that her weight weighs around 87 kgs and her height is 5.1 feet. And on systemic examination, there is nothing abnormal is seen. So when we analyze the life space, so patient belongs to a middle class nuclear family. It consists of her parents and her elder brother. Her both parents are strict in nature. They also had a very strained relations with each other, and mostly they have quarrels with their respective relatives. She is more attached with her elder brother. Though she was, again, I already said, she has a very good bond with her elder brother, but patient feels that her father loves her brother more than her, which developed a forsaken and deserted feeling within her psyche. Academically, patient is very good, but her father never appreciates her. This always disappoints her. Sometimes she felt left out in her own family. This early environment fostered her personality as reserved and sensitive. Socially, she has very limited friends. She mostly remains aloof in school. She is very loving and caring towards pets, as she feels that only animals can love her unconditionally. Along with that, she reads novel and watching romantic movies were also there. She has a crush on one of her classmates. She is around 20 years old. So, but due to her reserved nature, she never expressed her feelings to him. So, the triggering event. There is a two striking triggering events we can analyze in her life space. First one is 6 months back, where her crush got engaged. These events disturbed her badly, and her episodes of headache aggravated. And recently, her pet dog died due to old age. So after its death, she was very sad, and this triggers her headache. So from the case, I diagnosed the case as a migraine without aura. This diagnosis is made up again with the help of ICD-11 criteria, and the code is G43.011. So from the life space analysis, we can conclude patient as reserved, craves for unconditioned love, emotional, forsaken, and sensitive in nature. So this is the totality which I formulate by using again Kent's approach because of characteristic mental symptoms are present. So here you can see aggravation, grief after emotional loss, that is a dog's death, forsaken, reserved, anger suppressed, unconditioned love, wants of, sensitive to criticism, dreams oceans, dreams fly in sky, head pain throbbing, head pain congestive, head pain extending to temporal, head pain extending to left eye, head pain aggravation, sleep lack of, head pain aggravation, hunger during, head pain ambulation, hard pressure, female genitalia menses irregular, female genitalia menses scanty, female genitalia dysmenorrhea cramping pain, stomach nausea menses during, desire hot, sweet food, thermally hot patient, and perspiration profuse, especially on the back. So by considering this totality, this is the repertorization. As you can observe, most minimum remedy comes is pulsatilla, natramur, and noxomica. So this is the remedy differentiation of the close coming remedies, that is natramuroticum, pulsatilla, and noxomica. Again, we analyze the case on various aspects, and we find out those aspects in our materia medica, like the emotional state. In natramur, patient is reserved, sensitive, forsaken feeling, grieves from rejection, desire solitude, craving for unconditionally. In pulsatilla, emotional state is changeable, mild, weepy, seeks consolation, and craves affection. While in Naxomica, the mental state is irritable, impatient, critical, ambitious, and strong reactions to stress or anger. When we analyze the headache, natramur has throbbing headache, worse with heat, sun exposure, suppressed emotions, and along with that, wants to be alone. In pulsatilla, headache is throbbing, congestive headache, worse in a warm room, better in open air, and it is associated with irregular menses. In Naxomica, headache is pressive in nature, congestive, worse after mental exertion and after taking stimulants like alcohol. Menstrual symptoms in natramur is irregular, scanty, painful, after emotional suppression. In pulsatilla, menstrual complaints are delayed, scanty with backache, aggravation before or during menses. In Naxomica, menstrual complaints are painful, irregular, and early menses accompanied by irritability or anger. When it comes to the modalities, in atramure, complaints aggravated during heat, sun, emotional suppression, amelioration by heart pressure, and alone, means when patient kept alone. Pulsatilla, all complaints are aggravated in warm room by fatty food, amelioration by open air, mild motion, and gentle reassurance. In Nux vomica, complaints aggravated by noise, light, and stimulants, and amelioration by rest. Craving and aversions in atramure, patient having craving for salty food, aversion to bread and fatty food. In pulsatilla, craving for sweets and creamy food is there, aversion is not prominent. In Nux vomica, patient having cravings for spicy, stimulating food like coffee and alcohol, and aversion to bland food. Thermal state, in atramure is hot patient, pulsatilla is chilly patient, and Nux vomica is again the chilly patient. Sleep and dreams. In atramure, sleep is disturbed by grief or emotional stress, and patient having dreams of water. But in our case, there is a dreams of ocean. But in materia medica, atramure is in dreams of water. In pulsatilla, dreams of loved one and romantic themes was there. And in Nux vomica, patient having disturbed sleep, often overwork or indigestion. So, after doing all this remedy differentiation, final selection of remedy was natramure. That natramure is given in 1M potency because the intensity of patients presenting complaints is moderate to severe, the 3+ in nature. So it indicates her susceptibility is moderate to high. So by considering her moderate to high susceptibility, potency selection is high, that is 1M. And here is the follow-up criteria for the patient I formulate for this case. Here you can see the less menstrual period, head pain, menstrual flow, dysmenorrhea, nausea, menses during, and allopathic medication. Means whenever a patient is having headache and how much time she have to take allopathic medication, that is also included in follow-up criteria. So here you can see on 11th of July 24, case taking was done, and natramure 1M single dose was prescribed for 1 week. On first follow-up, that is on 19th July, no menses was appeared. Patient advised to come after 1 week, and an natramure single dose was again prescribed. On second follow-up, that is on 28th of July 24, menses appears, and menses appears 2 days before the follow-up, that is on 26th of July 24. Her other complaints like headache complaints and other complaints were reduced up to 30%, but her nausea during menses remains escape. So menses appears with 30% improvement in dysmenorrhea. So I kept the patient on SL. On third follow-up, patient came on 11th of August 24. Her headache complaints aggravated because she had some argument and she skipped her lunch. So due to hunger, her headache complaints were aggravated. So she took naproxen at that time. So again, natramure 1M was prescribed for 1 week. Again, on fourth of follow-up, her headache complaints reduced 30%, but intensity is low. She had an headache, but intensity is reduced up to 30%. She didn't take naproxen at that time. So natramure 1M was prescribed again. Her headache complaints persistent, but intensity is low. So same medication was prescribed. On fifth follow-up, that is on 30th August 24, menses appears just day before the follow-up. Other complaints were ameliorated up to 50%. So regular menses appears from last 2 consecutive months. but her complaints remains as it is. Sometimes it is aggravated. So again, Netramur 1M prescribed. On sixth follow, here I understood that her family environment might cause emotional troubles, as seen in life space. Like as you can see, in her life space that she might trigger her headache. So here I felt that her headache may have psychosomatic link. Till that particular time, I treat her headache as some hormonal imbalances, especially during her menses. So in successive follow-ups, I pay special attention to confirm my observation. So on 7th of follow-up, we can see her innermost feeling like forsaken and deserted feeling resurfaced. This might have triggered her headache. It shows that her headache is associated with her emotions. Here you can see her headache complaints are aggravated because she had an argument with her parents on her marriage. Her parents are planning for her arranged marriage, and this triggers her forsaken feeling. And because of forsaken feeling, her headache complaints are aggravated. So again, Netramur 1M, 3 doses. Now I increase the doses, and Netramur 3 doses per week was started. So headache complaint persistent, and that is caused by the anger after her argument with her parents. On 30th of September 24, again menses appears. On 27th of September, her menstrual related complaints goes down up to 80%, but her again headache complaints increased. Here patient says that her flow is also increased. Initially she took 1 pads per day. Now she took 2 to 3 pads per day. They are completely soaked. Her dysmenorrhea and nausea reduced up to 80%, but her headache complaints aggravated. But not take naproxen this time. Again, Netramur 1M. See, there is a mistake is there. Netramur 1HS was written. So here Netramur 1M 3HS was given at this particular time. So regular menses appears for consecutive 3 months, but her headache complaint remains on and off. So after this particular follow-up, patient was not coming for the treatment. So now I would like to share my learning from the given case. So first and most important learning from this case is importance of family dynamics. See, patient perceived that her father give preference to her brother. This creates a feeling of inadequacy and forsakenness in her. This emotion distress contributes to her psychosomatic symptom, which leads to her headache, which later diagnosed as migraines. There is a strained parent-child relationship. Arguments with her parents, especially about sensitive topics like marriage, further exacerbated her headaches, indicating how unresolved family conflicts perpetuated her condition. Support from sibling. Her strong bond with her brother served as her emotional anchor, but it was insufficient to counterbalance the negativity in her larger family environment. So my second learning from the case is role of unfulfilled emotional needs. As we can see that patients craving for unconditioned love and validation manifest through her attachment to her pets, novel and romantic movies. The loss of her pet leads to feeling of loneliness, further worsening her physical complaints, and her headache complaints were aggravated. Her reserved personality and inability to express her feeling openly leads to suppressed anger and grief, contributes to her physical symptoms such as headaches and menstrual irregularities. So my third learning was psychosomatic correlation of headache. The patient's headache was not merely physical symptoms, but were deeply rooted in her emotional state and family environment. Her recurrent migraines were aggravated by suppressed emotions. The patient experienced long-standing feelings of rejection, lack of appreciation, particularly from her father. These emotional suppressions triggered frequent episodes of severe headaches. Emotional triggers. Significant events like her crush engagement, and her pet's death acts as a catalyst for exacerbating her condition, highlighting the psychosomatic impact of grief and loss. So my last learning from the case is importance of holistic approach. We should understand the emotional triggers. This case underscores the need of identify and address underlying emotional conflicts and environmental stressors along with physical symptoms. The patient's physical symptoms were deeply intertwined with her mental and social experiences. A holistic approach, including counseling and emotional supports, was critical to her healing. And the last point is patient's empowerment. We should encourage the patient to articulate her feelings and address her suppressed emotion could have expedited her recovery and prevented future recurrences. So, what are the key takeaways from my two cases? So, first and most important key takeaway is the importance of psychosomatic understanding. The key point here I would like to highlight is emotional suppression and unresolved internal conflicts often manifest as a persistent physical complaints. So we need to, when the physical symptoms persistently present, even after giving well-selected, we should analyze those cases through a psychosomatic angle.
Sir, we
My
can conclude.
second key
Hello, sir. Just 3 minutes only. So
Yes,
we
sir.
can conclude here since we
Okay,
have
okay, okay.
another session coming.
No
So
issue. No, these are the last thing, and then I have just last two for slides, and
just
then I will conclude.
you may just conclude.
Yes,
That's all.
yes, yes.
No need of reading the same.
Okay, okay. No issues. Okay, okay, okay. So last point is the building trust and doctor-patient relationship that I already mentioned. And the last is holistic management. So key point is homeopathy should be integrated with psychosocial interventions for comprehensive patient care. So here, before I conclude, I would like to thank Dr. M.K. Sahani sir and Dr. Dhanesh sir for this wonderful platform to share my work. I also deeply grateful to my principal, Dr. K.Z. Patil, for his consistent support. Thank you for
Yes.
your attention. Now, if you have any questions, then kindly ask.
Yes, since there is no time,
Thank you.
there is no time for discussion also. We could have closed at a single case because that first elaboration itself was very excellent. Though you presented two cases, both cases were brilliant, and your selection of symptoms as well as selection of rubric and everything, and finding out the remedy, and then after giving the remedy, you just wait for repetition, and as and when it was required, you just repeated the same, and you got the result, and you were able to prove that homeopathy is the most brilliant scientific thing in the world. So that's what we have noted in this session. So it's the time to say vote of thanks to the session. I invite Dr. Chandrika Mohan. Are you there? Yes, please unmute and you can say the vote of thanks to the session.
I am very happy for give vote of thanks for you, Doctor. Your class is very informative and valuable for all the generation of homeopathy. Your psychosomatic approach is very good. Your personalized individualization is very important in our homeopathic case taking. You are very appreciating for this purpose. I gave a vote of thanks for behalf of our IFPH and myself. Thanks.
Thank you, Dr. Chandrika Mohan, Dr. VIPAKSHI WASNIK, and those who attend the session. Tomorrow we will have a day to celebrate the 1600th day of our Zoom continuous Zoom session. We really planned in a big way, that is to give honoring our NCH chairman Annie Kurana a warm appreciation for taking homeopathy into higher level, and that means he has he has given orders for starting 6 courses as per the request of International Forum for Promoting Homeopathy by our president, Dr. Ismail Said, at the meeting in Kottayam. And sir has told us that definitely we will start to think of that in that lane, and they give approval to the 6 courses immediately with the effect of this year itself. So we are congratulating all the team NCH there who are doing such a wonderful job in promoting homeopathy all over the world also. So we request all of you to participate tomorrow at our celebration in our English Zoom, as well as there will be another session, a celebration going on at Hindi Zoom also. So with that, we come to the end of the day, 1,599. Thank you all. Good night. See you tomorrow. You can join by the same link you used today for joining. It's over to Dr. Mariamma John to moderate the Malayalam session.
നന്ദി ദിനേശ് ഡോക്ടറെ. എല്ലാവർക്കും നമസ്കാരം. IFPHന്റെ 1599 പ്രതിദിന സൂം വെബിനാറിലേക്ക് എല്ലാവരെയും സ്വാഗതം ചെയ്തുകൊള്ളുന്നു. ഇന്ന് നമ്മുടെ ക്ലാസ് ആരംഭിക്കുന്നതിന് മുമ്പ് ഒരു നിമിഷം